They feel like they're failing their community because they just don't have the resources that's needed to provide the care that's needed for the people.
Registered Nurses Union President Yvette Coffey is sounding the alarm.
Our people in this province deserve better. The nurses who are working in this province deserve better. The entire healthcare system deserves better.
The time for transparency is long overdue, says Coffey, who is asking for proper funding for nurse practitioners, safe working hours, and above all, accountability.
I think there is a lot of room to improve transparency about what's going on in our healthcare system. The leadership needs to be listening to the front line. And we want accountability for the word used by the Auditor General, which was fraud. We want people held accountable for the misappropriation of funds, which are our taxpayer dollars.
Only halfway through her tour, and Coffey says the message from her members, especially in rural areas, is very clear. They don't have the resources that they need to do their job properly.
At the end of the day, every single person in this province deserves and needs to have access to primary health care, to their basic needs being met. And that is not happening in these rural and remote communities. That is not happening in the big urban centers.
With an election looming, Coffey hopes whoever forms government is ready to act, because the nurses of this province are looking for answers.
I'd invite any of them to go visit any of these sites and actually sit down and listen, like really listen to those frontline nurses and staff in these institutions, in these clinics.
In a statement to NTV News, the Department of Health and Community Services said the government of Newfoundland and Labrador values the role of nurses and is actively working to improve their working conditions with several initiatives, including successful recruitment. In addition, the department noted the collective agreement with the Registered Nurses Union for nurses is worth an additional $110 million a year in compensation and benefits, such as wage increases over 4 years, new pay scales for nurse practitioners, and improvements in shift scheduling. Marykate O'Neill, NTV News.